we present at the ASH meeting an update about the long-term follow-up of two clinical trials already published and reported for patients treated with anti-CD20 plus Michot, which is attenuated chemotherapy for patients elderly, so not eligible for full R-CHOP. So it's patients populations of more than 80 years. And rituximab or anti-CD20 plus Michot is a standard of care, but we have no idea and no study who check the long-term follow-up of this population of patients. Of course, there is a lot of events which is normal in such a population, but we would like to check if long-term follow-up is safe for the treatment proposed by anti-CD20 plus Michot. So we complete a study with long-term follow-up in LNH 037B and LNH 097B, so two phase 2 study with R-Michot or ofatumumab Michot, two studies, so evaluated anti-CD20 plus Michot. 149 patients in 037B and 120 for the 97B studies. So in total, 260 patients were included in the long-term follow-up analysis. And we check the PFS, OS, and cause of death. And also we check for secondary primary malignancy. And we compare the outcome of the patients with general population healthy based on health-based study. And we could say that the PFS the PFS median was 2.4 years, and the overall survival median was 4.1 years. So it is very satisfactory in such elderly populations. And we do not see any significant difference between the two studies. Interestingly, the second study with ofatumumab Michot included a prephase to control the disease before to start the full R-Michot or anti-CD20 Michot. And then we could see there is no death related to the treatment in the second study with the prephase, and we think it should be a standard of care to give a prephase of treatment with just one dose of chemotherapy plus anti-CD20 before to start the full completion of anti-CD20 plus Michot to avoid toxicity, especially for the first cycle of treatment. So it was interesting to see the main cause of death was related to lymphoma. We do not see any significant elevated cause of toxicity with this treatment. So the treatment was well tolerated in general with this regimen in such population. And we see secondary malignancy could arrive with a rate of 6.3% of the total population. So it's not very high. And it means that there is no specific signals of long-term toxicity with anti-CD20 plus Michot. And this remains the standard of care for this population. Interestingly, we also check the outcome of patients as compared with the general population at the same age, same sex. And we do not see any difference between patients treated with anti-CD20 plus Michot as compared with the general population. As you know, the mean age of expectancy to life in the country, France, is near 83 years. So the mean age for the inclusion was the same, and it means that the patients treated with this regimen is very similar to the expectancy of life of the general population. We do not see any difference. So it means that this type of population eligible for anti-CD20 plus Michot should be treated with any issue, any complaints, as the objective of the treatment still to be cure the patient, even if the patient is very old.